So we'll move on. We have Dr. Osama who will give us talk about his project, evaluation of exercise, physical exercises in Omani children with congenital heart disease. So this is the last, but the not least, project. And after that, we will start distributing the winners.
Okay, assalamu alaikum. Good morning, everybody. I'm Dr. Osama Alawidi, R2 Pediatric Resident. On behalf of our study group, I will talk today about our study, which is physical exercise in Omani patients or Omani children with congenital heart disease. So, no disclosure to start with. Okay, it seems I'll use mouse. Okay, these are my outlines. Okay, so congenital heart disease are the abnormalities in the structure of function which are started since a neonatal period, and it involved the heart or the vessels coming out of it, and it is classified into cyanotic or acyanotic according to the presence of cyanosis and deoxygenated blood. And because of the advancement in the medical treatment of those children, they are getting older and older, so they are getting also the adult heart disease. So we have to prevent adult heart disease by controlling the weight, controlling the diabetes, hypertension, and all of these factors causing heart disease. And as you know that for children, it is recommended for them to do moderate to vigorous exercise for 60 minutes daily. But this amount of exercise, unfortunately, it's not really there in those who are having congenital heart disease. It's way less. And this is internationally. So our hypothesis that the perception and the ideas of cardiologists and also those who are taking care of those children, they affect their participation in physical exercise. So our primary objective, to gather representative information of the actual amount of physical exercises in Omani children with congenital heart disease, and secondary objectives is to assess the factors that could affect their participation in the sport, their participation in sport, and which affect also the cardiologist and parents' decision on allowing those children with congenital heart disease to participate. So our study is a cross-sectional study. We have done it through two centers, SQH and Royal Hospitals, which are the main treatment centers for those patients. And we've gathered all the children with congenital heart disease coming to the cardiac, those two centers from January 2019 to January 2023. And we included all Omani children with congenital heart disease aged from 5 to 18 years. And we excluded those who cannot physically exercise, like those who are disabled, those who are having like syndrome surgery within the last 6 months, single ventricles, cardiomyopathies, and of course those who decline to provide consent. We've used SPSS, and we've used the usual statistical analysis. So the questionnaire, we just phone the parents, then ask them for the consent. Then we ask them a couple of questions about the background of the parents, background of the children, their participation in sport, and also their cardiologist advice. So these are some of the questions we have asked them. So going into the results, the mean age was 11.4, and the gender distribution was almost equal. Cyanotic, those children with cyanotic heart disease, they comprise 21%, which is comparable to the international percentage. And most of our study grouped parents, they hold the bachelor degree, diploma degree followed by bachelor. And the distribution of the gender on the on cyanotic or acyanotic heart disease was also comparable. So the mean time spent in physical exercise in our study was only 1.1 hour, which is way below the recommended time. And as you can see, most of them, they are exercising for less than 1 hour. Actually, half of the cyanotic patients, half of them, they exercise less than 1 hour. Okay. However, the participation in exercise, like the overall participation was comparable, and it was 84% for both cyanotic and acyanotic. So most of them, they were participating in exercise by walking, followed by football. And this is here highlight the importance of paving the places for such sports. And most of them, they report shortness of breath and also surgery, of course, after the, not within 6 months, because we excluded those while in less than 6 months having surgery, and also syncope as the most reasons for them not to participate in regular sport. When we see the relation between the cardiologist encouragement for exercise between the cyanotic and acyanotic, we can see that it is clearly in cyanotic, it is less exercise compared to those who are acyanotic. And we have another also significant result, that the more cardiologists giving the advice, the more they will participate in sport. The parental allowance for participation in sport was comparable between males and females. And also here another result about the recommendation against sport participation from community and its relationship into the parents preventing their children from participating. We have seen that the less recommendation, the more the parents, less, if the community will not tell the parents to stop the participation of their children, so the parents will allow them more. Okay. Comparing the educational level of parents between if they are like preventing or allowing, it is significantly not statistically significant, but we can see in orange that the higher the educational level, the more they allow their children to participate in sport. Okay, here another relationship between parents who are having cardiac disease, they will prevent their children more from participating in sport. Okay, we've done also regression analysis of the potential factors which are influencing participation of the children in the physical exercise. It is significantly statistically significant for place of living. Those who are living in apartment, they will participate less in sport. Also, mother and or the parents who are participating in sport themselves, they will also allow more. They will allow their children more. to participate in sport. And the more or the less encouragement from cardiologists about participation, the less those children they will participate in sport. So the limitation of our study was that it is a retrospective study, and it is by phone call. So many of them they will not respond to our calls. So we missed some of the patients, but to be honest, most of them they respond to us, and also they are more prone to recall bias. For example, for the cardiologist advice, we did not go into for the cardiologists themselves, but rather the parents' perception, what they have what cardiologists have told them. So the conclusion: Omani children with congenital heart disease are practicing sport below the recommended hours, and healthcare advice, living environment, parent sport participation, and also other factors, they play a major role in encouraging children with congenital heart disease to participate in sport, and implementing educational initiative and proactive advice by healthcare professionals are needed. These are our references, some of them, and thank you very much. Yes. Sorry?
You mentioned cardiac arrest as a reason, one of the reason for not doing.
Yes, so those with congenital heart disease, as you know, they are more prone to have cardiac arrest, especially when they are sick. Okay, so those, like the parents, when they see their children having cardiac arrest, they will be more afraid to have anything which may lead them to like syncope. The history, yes. Yeah, otherwise they will not be dead.
Did you look at the percentage of patients who were advised about exercise from the cardiologist? Are they all advised for that?
Yes, that's what this one, no?
What's the percentage? You said that those who are advised, they are more likely to do exercise.
Yes.
What is the percentage of?
Yeah, I will just see the.
Or were discussed about the level of exercise.
Yes. Okay. Okay, so this is according to acyanotic and cyanotic. So acyanotic, almost half of them, half they were encouraged, half they were not given the advice. But compared to the cyanotic, only 1/3 were encouraged. And there is another significant result, I forgot just to put it, that those who are encouraged by cardiologists to exercise, they were more likely to exercise.
What's the conclusion?
So our conclusion that the cardiologist advice is very important for such specific type of patients, because in general we know that like it is for everyone, it's very important to participate in sport. However, those with congenital heart disease, sometimes they are more prone to have cyanosis. Should they exercise like others? Yes, they should, unless they are prevented by cardiologists. Like, for example, those who are having single ventricles, epistian anomalies, and other anomalies, they are specifically prevented. However, in general, congenital heart disease, even those who are having cyanotic type, they are not prevented.
Thank you, Osama, for this presentation and your research. Just what's missing on the background, you did not explain exactly why you were concerned about physical activity in this high-risk group. So you have to discuss whether in your literature review, was physical activity is actually very important, clinically significant? Does it improve the outcome, the prognosis, and all that?
Yes.
So from your research, literature research, did you find that it's very important for patients with congenital heart disease to exercise?
Yes. It is reported in general that it is those who are participating in sport, they are more like having less adulthood cardiovascular diseases. However, in the past, many of those having congenital heart disease, they will die even before reaching into 40s, 50s, where they have more cardiovascular diseases. So this is something new. I think we have to do prospective studies to make it more clear.
And the other question is, do you think that, again, when you go to the population, you are concerned with a very high-risk group about physical activity, but when you look at the general population, do you think most Omani children, they exercise more than 1 hour a day?
No.
Yeah.
But they are not meant to be more than 1 hour. That graph was for the week.
For the week?
For the week, yes.
So again, you have to mention what is the recommendation actually for what is the recommended, as a comparator, what is recommended for this group to exercise per week, and whether we are falling below that or meeting the requirement or not. And then
this was the one. So 60 minutes a day. It is similar actually to the normal population of children. So compared to even adults, they are required to exercise less.
Exactly.
Yeah.
Exactly. So this is actually similar to the recommendation for pediatric age group in terms of the physical activity per week.
Yes. So it's the same.
Exactly. So here maybe a comparator would be some from general population again, whether we have
the recommended
questionnaire for the general population to see if there is any big difference, but because this is quite similar. I agree it's similar. But I don't know, maybe it's something interesting to look into.
Yeah.
I don't have any further questions.
Thank you very much, Dr. Osama. I think this is a nice, novel idea of an important issue that's usually overlooked. I think to echo the comments from Victoria, I think because you're doing phone interviews, that makes it an interesting. It introduces some limitation, but it is good in the sense that it's somewhat prospective. It has some of the benefits of prospective studies, not really longitudinal perspective, but it gives you control over the data that you're going to get, as opposed to just chart review, right?
Yes.
So that's an advantage. And it also opens the opportunity to get good controls. So I think if you can find somehow matched age controls of healthy children from the community or from some polyclinic or something, and you can just match them and compare them, congenital heart disease versus others, that would, I think, add a very nice strength to your research methodology.
Sure. I think that's doable. That's doable, and
just make more phone calls. 2 phone calls instead of 1. But you have to choose carefully the matching, right? Like you want to match with some population that's healthy, so it's a little bit tricky how to choose exactly, but it can be done.
Sure.
Second is regarding the exclusion criteria. So it's a little bit quite broad, the definitions here, like children with mental health issues. Okay, what if a child is suffering from anxiety or high functioning Asperger, they're excluded, so I would define it a little bit more specifically, maybe severe, debilitating mental health issue or severe physical disability like that, rather than, because also syndromic child, what if they're high functioning and they're part of like milder syndrome or something like that. So I would be careful with the exclusion criteria because you don't want to stigmatize or unnecessarily exclude or even make broad definitions, but then when you look at the actual study population, you find there are actually some children there who should have been excluded by your stated criteria.
Yeah.
Right?
Sure. Although in our like when we did the phone calls, there are not many of them, to be honest. They were excluded.
Yes.
Yeah.
Yeah, but you just have to be careful with the wording, or just make it more precise to more severe disability.
Sure.
The other thing is developmental, because how do you, like for adolescent, exercise is a little bit more maybe defined, right? But for children 5 to 8 years of age, they're like playing in the playground. They're not really involved in something that's easy to measure.
Yeah.
As far as sports. So how did you address that?
It's actually we've done it just by the parents reporting. Yeah, we ask them if they are physically walking to some of the minutes they are walking in one day with the other physical exercises types also. Yeah, so it's just on the reporting of the parents. I know this might be drawback, but to be honest, it's not easy to do it another way.
If it is validated questionnaire specifically for physical activity, it should include all of the for the type of exercises for different age group. So was that included in your questionnaire? Like what type of exercise for a certain age group?
Not for certain age group, but we ask them a lot of the types of physical exercise. Even we included, for example, those which are not common here, like volleyball, whatever.
So the questionnaire is not validated for our population.
Yeah.
Has it been studied before compared with other different questionnaires? So this is something also to look into. There is a better questionnaire or better screening tool for
Sure.
study.
Sure.
Using quantitative method for a smaller number of families where you get more details and themes, maybe like as a next step, because that will tell you more details and in-depth analysis rather than just a questionnaire over the phone. This is just a future.
Okay, so you mean to have interviews face to face with them?
Quantitative always gives you these small details about, because over the phone parents can say anything, as my colleagues mentioned.
Sure.
Case control is another methodology that can be used to refine your data.
Okay, great.
If you're really motivated, you could say invite them to wear one of these smart devices for 2 weeks or 1 month, and that will give you a very objective
surely.
measure of physical activity.
Yeah, but most of them they will not have it.
In cheaper versions like Huawei.
لا هواوي بعد أغلى دكتورة فيه أرخص. Okay, thank you very much.
Well done. Thank you, everybody. It has been a long day. Most of the people already are committed to work, so most of them left. But I really appreciate everybody here.